Well, good afternoon. I am Judy Collins, and I am an educator, a massage therapist, an artist. Those kind of my backgrounds. Been doing massage about 25 years. I have my own business. Been teaching for probably, I don't know, a little over 20 years in the massage therapy industry. And I love essential oils. And I love using them for medicinal and therapeutic purposes. So that's why I'm doing this presentation for you today. So thank you, Magda, for the opportunity to cover this. And I'm sure, many people have used essential oils. So I would love for you to share like your favorites or anything you want to add or have questions. Please interrupt and do so. So we can learn from each other today. So are we ready to go?
Yes.
All right. So this is our topic of discussion today. We're going to discuss the history a little bit, just a brief history and application methods of essential oils, the medicinal and therapeutic uses, daily uses and precautions, and then I've also included some brands, and then I also included some of the things I use oils for. So here we go. So obviously plants have been all around a long time. Since the beginning of time, they've played an important role in many civilizations and supportive medicine, obviously, since they did not have pharmaceuticals back in the day. So they've been a part of religion, marriage ceremonies, cosmetics, funerals, medicine, and other aspects of life. And they have evolved a lot. There's specific companies for essential oils now. But the principles and the benefits of oils have remained the same. So how do we get them? So they are extracted from aromatic plants, and people think they are the most effective medicine known to mankind since the beginning of time. And as we look at some of the benefits, I think you'll agree to that. So Egypt, China, Greece, Rome, Israel, Arabia, and in Europe, dating back to 1550 BC. For the history of oils being used, they were steamed and distilled and used for many of their medicinal and therapeutic properties. Some of the oils that they used were frankincense, myrrh, cedarwood, spikenard, juniper, coriander, bitter almond, henna, calamus, and oregano. So a couple of those, the spikenard and the oregano, I had to look up because I had not heard of them, and they're very interesting oils. But a lot of these you can tell were more in the Middle East because of the plants they had there, or ones they used. So what is aromatherapy? It is also called essential oil therapy, and it's the use of fragrant essential oils by inhalation or blending with products such as massage lubricant for topical application. Rene Maurice Gottfasser was the first to coin the phrase of aromatherapy, from which aromatherapy is defined. I apologize. I do have a cat and I may have interruptions. You never know. He's trying to interrupt right now. Okay, the extractions of essential oils or oils from the plants. I think this is really interesting. And there's a lot of chemistry involved, and there's a lot of processing involved, and it can be very costly, and it takes a lot of plants to make one drop of oil. So that's where a lot of the expense comes in as well. They are extracted. I've shown different pictures here of the different parts of the plants, the leaves, the seeds, and the roots. And so depending on the type of extraction, and how many plants there are in the world, basically, or the global supply will determine the cost of the oil as well. So I just listed some of the different parts of the plant that are used and what oils are associated with those parts of the plant. So flowers, you get your lavender oil and your jasmine oil from the flower of the plant. Fruits, obviously bergamot, lemon, orange. So they use the rind usually, and compress, like cold press those fruits to get the oils out of them. Grasses, an example is citronella. Leaves are commonly used, probably most frequently, for extraction, and eucalyptus and peppermint are some of our favorites. Roots of ginger and vetiver are examples that we get from the root of the plant. Seeds, black pepper, fennel. Tree blossoms are ylang ylang and clary sage. And woods and resins would be sandalwood, frankincense. Pretty interesting. How are we doing? Any questions so far? Any? Okay. A lot of you know a lot of this because they've been around a long time, and some of you even may be distributors of oils and testing me, who knows. Types of dispensing, and I included these 4. Inhalation of basically inhaling the plants or in a mist or vapor form through the mouth and the nose. And diffusion, you usually add water to dilute the oil and diffuse it into the air with a mist or vapor. Or topical, which I use on a daily basis in my business, obviously applying directly to the skin and usually using a carrier oil to add to dilute the oil for that. If you do use an essential oil that is undiluted, it's called neat, kind of like alcohol is. If you have a neat drink, it's not diluted, it's not combined with anything else. So that would be a usage of the oil like that. It's usually not recommended to use it in that way very often because they are so volatile and very strong, so they can damage skin sometimes if they're not combined with carrier oils. My head is blocking my PowerPoint. Internal, you can take orally, under the tongue, sublingually, or in capsules, or you can add it to a beverage. I think a lot of people didn't know you can ingest essential oils. So this is where I started. I have three different slides that list essential oils and their medicinal and therapeutic benefits and common uses. And then I kind of divided them with how they're distilled. So this first slide is from the leaves. So I'm sure many of you have used tea tree oil in some form. It's also termed Melaleuca, and there's the whole company. I don't know if you've used the company of Melaleuca, but most of its products are derived and based on tea tree oil adage. I love that company, actually. Have a lot of good products. And so it is, again, distilled from the leaves. It's with steam distillation. And some of the properties of tea tree are, it's an analgesic, which is pain management. It's an antibacterial, antifungal, anti-infectious, anti-inflammatory, antioxidant, antiviral. It's also a decongestant, a digestive aid, an expectorant, an immune stimulant, an insecticidal, neurotonic, stimulant, and tissue regenerative oil. So basically, you can use it for a lot of things. And you'll find with a commonality with all of these oils I've listed that are distilled from leaves, which is They're all like antibacterials, antifungals, all of that. So they're really good for the body and preventive medicine. Common uses of tea tree oil, most oftenly, I would say they're found in products for the feet because it is an antifungal. Acne, allergies, bacterial infections, feet, bronchitis, ear infections, shingles, and immune system stimulant. Anybody out there use tea tree oil? Magda does. Just not in the bathtub, right?
No, not in the bathtub. No.
So, yeah, tea tree is probably one of the most common oils that a lot of people, even if they're not in the alternative medicine arena, they know about tea tree oil a lot of times. So the next one, distilled from leaves, is eucalyptus. Tea tree oil really doesn't smell that great. So standing alone, it's not a great olfactory scent. But eucalyptus, on the other hand, kind of is, and it has a lot of the same qualities. So people use eucalyptus oils. I would say just the aromatic benefit from that is great. So it's an analgesic as well, an antibacterial, anti-infectious, anti-inflammatory, antiviral, insecticidal, and an expectorant as well, just like tea tree oil. A lot of the common uses are an arterial vasodilator. So medically, that means it opens up your arteries, basically, so your blood flows a little bit more freely. Really great for respiratory stuff. Eucalyptus, which we probably all know, you've seen pictures of in the spas where they hang eucalyptus leaves in the shower to get that benefit of aromatic and really medicinal benefits in the shower. It helps brain blood flow. It's good for bronchitis, congestion, pain, coughs, jet lag, which I thought was interesting. I had never heard that benefit for eucalyptus. Kidney stones and overexcited muscles, and rhinitis, which is a cold, or sinusitis.
You know, actually at Trader Joe's, they sell branches of California eucalyptus, so I also buy it for my shower to hang it in the shower. Or I put a drop of eucalyptus oil on the shower floor, and the steaming of the shower kind of makes it smell like eucalyptus.
That is amazing. I mean, it totally changes your shower experience, right? You feel like you're having a therapeutic shower rather than just some hydrotherapy,
Yeah,
right?
yeah, it smells nice.
Okay, thank you. Peppermint. We all know peppermint. It's very common. It's widely used. It's also distilled from the leaves. Has all the antis there. There's an added anti-carcinogen, which is for anti-cancer forming, anti-inflammatory, antiseptic, antispasmodic, viral, and then it's very invigorating. Common uses are headaches, because it's a vasodilator as well as eucalyptus. So that helps, like if your head is throbbing, it's nice to put a couple little dabs behind your ears. Make sure you don't get it close to your eyes. Asthma, alertness, bacterial infections, chronic fatigue, congestion, constipation. So it's also used digestively a lot. And you know, have you noticed like all the gums or some kind of mint, right? Because mint is so great for your digestion. Go ahead.
I had a comment. I use a cooler an awful lot. I've got a boat at a lake, and I always put mint at the top of the cooler. It's very refreshing and helps with odors.
Oh, I love that. That's
Yeah,
a great idea.
it's very nice.
Very nice. Thank you for sharing that. I think hopefully you may want to get a piece of paper out, because I think you know, we've already had a couple really great usages of these that sometimes we don't think of. So I love
Mhm.
sharing how we use these. Geranium is one of my favorites, actually. It's an antibacterial, anticonvulsant, um, antidepressant, anti-inflammatory, diuretic, antiseptic, insect repellent, refreshing, relaxing, sedative, and a tonic. And common uses are for agitation, autism, actually, bleeding disorders, gallbladder stones, jet lag as well. Great on crow's feet around your eyes. Huh. Long as you don't get it in your eye. Well, that's good to know. I appreciate that input. Y'all are awesome. Okay, we've got more. There's, 4 million oils. So I try to just pick a handful of each types of distillation. So these are distilled from the resin or the bark, the rind of a fruit or a flowering top. Frankincense is from the gum or resin of a tree, and there's different types of trees that are used for frankincense, which will, a lot of times it'll have, the Latin name will have like boswellia or whatever it is, boswellia. They'll have the different types of trees used on the oils, which is interesting as well. That's a whole nother component of which tree and how many varieties of trees that are used for oils. It's a anti-catarrhal, which removes excess mucus from the body. Anti-cancer, anti-tumor, antidepressant, anti-infectious, and anti-inflammatory, and antiseptic, immune stimulant. So this is like the overall healing oil that I would say, as far as from a massage therapist point of view. One of my areas of specialty is working with oncology patients. So I love to use this. I have had a lot of anecdotal evidence from patients, cancer patients, that say they take it in a gel cap and a lot of times their cancer markers have not increased. So I'm a huge believer in frankincense for the cancer patient, and about anyone, obviously. It does so much. It's really good for arthritis. You can rub a little bit around your joints if you have arthritic tendencies in your shoulders or knees or whatever. It's good for Alzheimer's disease. It's really good for the brain. Aneurysms, traumatic brain injuries, confusion, concussion, Lou Gehrig's disease, which is also called ALS, and postpartum depression.
And I have a question. Is the resins, some of them come from the Middle East, I think Yemen, and they are very expensive.
Yes.
And is frankincense the same one they use in Catholic Church during the, is it the same
Yes.
thing?
Yes, it's
Yeah.
usually the one in the incense.
Yeah.
Burner.
It's a very good smell.
Yeah, I mean, it's a smell for me that took a little getting used to, but
Uh-huh.
the more I use it, obviously the more I like it. But it is kind of I wouldn't say bitter, but it's just a really strong particular smell. I like what you said about it's used as a moisturizer like geranium.
Mm-hmm.
It's pretty great.
Mm.
So orange and lemon are two citrus oils I added to the blend here, and they are cold pressed from the rind, both of them. They both have a lot of the same similar properties and uses. Some overlap, some don't. So actually, as I was preparing this, I did not know that orange was an anti-cancer oil, so that was interesting for me to learn. Antidepressant for sure. I mean, the scent of orange, wild orange, is so amazing. It just really lifts you. It's a very good stimulant. It's an antidepressant, antiseptic, antispasmodic, digestive, sedative, and a tonic. It's used for anxiety, sluggish digestion. I mean, the anxiety, and we could talk for hours about that. I mean, the majority of my massage clients have anxiety, I would say. There's just a lot of anxiety in the world, a lot of stress. So I think the citrus oils are really beneficial for that. Fear, heart palpitation, excuse me, insomnia, menopause, nervousness, heartburn, and it's uplifting. And lemon as well has a lot of the same. It is an antifungal, where the orange is not. Also an antioxidant, antiviral. It's used again for anxiety, arteriosclerosis. I can never say that word, but for your arterial flow as well, the hardening of your arteries is what that is. Bites and stings, and blood pressure regulation, cold sores, and brain injury. The lavender is obviously one of the top used oils, and it's probably one of the least or the less expensive oils because you can grow it prolifically almost everywhere around the world. So that makes it a little bit less expensive and more available. So it's an analgesic for pain as well, an anticoagulant, anticonvulsant, antidepressant, antifungal, antihistamine. Basically, just use it for everything. Just put it all over your body. Really helps with sleep. I thought abuse was an interesting listing for a common use, just for calming. Appetite loss, anxiety, allergies, bite, stings, burns, dandruff, diaper rash. I can't see the slide. Diabetic. Maybe someone else can read it.
Diabetic sores and grief and sorrow.
Thank you. Everywhere that my mic is, it's covering it. Okay, I'm trying to move things. I'm not, sometimes I'm not real computer savvy, so I apologize. Grief and sorrow is really interesting with lavender, and I think that needs to be applied in that demographic a little more often. How are we doing?
Good, good.
Okay. I'll keep going till you kick me out. This is a few oils that are distilled from the flower or parts of the flower, and they're steam distilled. All of these. Clary sage is specifically really kind of, I call it the female tonic, if you would. The properties are a lot of the same as the other ones as far as astringents, antiseptics, soothing. It's used for a wide balance for female hormone imbalance. I thought this was interesting. It was nicknamed Clear Eyes during the Middle Ages for its ability to clear eye problems. So you wouldn't put it in your eyes. So I'm assuming you just topically and you would ingest it more so. I'm not sure how they used it. If they dropped little droplets or they put the flowering plants on top of the eyes. I'm not sure how they did that in the Middle Ages, but anyway, a little tidbit of information. Also good for aneurysms, cholesterol, abdominal cramps, emotional stress, estrogen and hormone balances, and infertility, infection, and lactation. You definitely don't. There's another slide that has a little contraindication, if you would, or a caution towards clary sage. You do not use this with pregnant women. Melissa is also called lemon balm, is distilled from the leaves and flowers. Has all the antis there, and antimicrobial. This is interesting, and it's uterine supportive oil. It's calming for nervous disorders, helps cold sores, viral infections, and promotes fertility. Interesting. Rosemary is another one of my favorites. I love the way rosemary smells. I love growing rosemary. It's fairly easy to grow. It's distilled from the flowering plant as well. Analgesic, antibacterial, anti-cancer, oxidant, inflammatory, and expectorant. Common uses: addictions, arthritis, adenitis, which is an inflamed gland. So if you had like inflamed lymph nodes or inflamed glands from being sick or drainage, it's useful for that. Really good for memory and mental clarity and detoxification and hair loss. So I've used rosemary and passed around to do a little inhalation for my students on testing day to give them mental clarity before they test. Helichrysum. It also removes that excess mucus from the body, and all the antis that we talked about. It's an expectorant, a mucolytic. Common uses: AIDS, HIV, blood-related issues, bone bruise, broken blood vessels, cleansing, dermatitis, eczema, earache, and lymphatic drainage. So that's all my listing. I do have a book with me if anybody wants me to look up any kind of oil, or just let me know, because I do have my book with me. I'm going to kind of move into some different uses of the oils.
Can I say something?
Please.
You know,
Yeah.
I always have some sort of a feedback, you know.
Yes, I need that. That's kind
So
of weird.
I also clovers and oregano I have in the refrigerator, and it's for toothache.
Oregano and what else?
Clover.
Clover. Okay. Yeah.
You know, oils. They are not really herbs or whatever, but they are
Right.
oils.
Yes.
But so because one, you know, so they are good for toothaches. And then
Yeah.
also, it must be mentioned the rose oil, because it's the most expensive oil, and that's where the most perfumes are derived from. And I think several ounces of pure rose oil, the Bulgarian one, is the most expensive. There, you know, there are different variety of roses, and it could be thousands of dollars. That's true, Judy, right?
Yeah. That's insane.
Yeah.
Yeah.
So if you look up rose oil, they are really expensive. But
Yeah, and it's also an aphrodisiac.
really,
Yeah, in case you needed that instead of something else. So anyway, I just saw that as one of the properties or the common uses of rose oil, but yeah, it's very expensive. I would say the most expensive oils are Melissa, frankincense, and rose. From my experiences. Clove oil. I love clove oil as well. I mean, we used to use that as kids.
that's what I thought. That's what probably I meant. Clove oil, not clover. Clove oil.
Clove oil is really great for your teeth. I mean, you can,
Yeah.
it is a numbing agent. You can just take a little bit of it. I mean, we're talking a little bit drop and just rub it on your gum.
Yeah, that's what I meant. I just
Yeah.
get clove and clover confused, I guess.
That's okay. You're allowed.
Yeah. So yeah, that's, and yeah. And you can make out of this, you can make your own like dental like
yeah, toothpaste.
yeah, toothpaste or water.
Can
And
you use it on teething babies? Well, I would say that would be probably a pediatrician question, just because you're not supposed to use essential oils on infants, really. So, because they're so strong and they're in such a, you know, beginning stages of development, that it could harm tissue. I think the amount or the quantity is probably the challenge with that, more than the medicinal purpose. So, I would think if that was the case with infants with teething, that's a really great question. I would think it would already be in a lot of products on the market, you know, because teething is obviously common to every single infant. So yeah. That's my input. But I definitely would consult your pediatrician with that. These are just, I mean, you all probably have a million, you've already told me a million things. I love was it the mint and the cooler? That was brilliant. So laundry, obviously you can add, I always add baking soda to my laundry. Just it makes it a lot brighter. The colors and everything, and it just makes me feel like they're cleaner instead of using like a bleach. Sometimes I'll use baking soda, which has different properties, but you can add it to that with your laundry. I mean, look at all this. I mean, how many scented laundry things are out there now? I mean, what was the Downy Unstoppable? What, I don't know. Are they called Unstoppables? I don't remember. They're the ones that you add to your dryer, and they've got 4 million different scents, you know, to make your clothes smell good. So
And it's actually very toxic,
yeah,
you know.
okay, yeah. Well, yeah, I would, you know, that's the thing. If people call something as an essential oil, you really need to know what's in that oil.
Yeah.
I definitely would not buy any of my essential oils at Walmart because they're driven on price point, and you may not get the most natural and the most processed oil. We're going to talk about some brands in a minute, but definitely want to make sure you know what.
Somebody is just commented on you about using essential oils on dryer balls rather than
Softener.
softeners. Yeah.
So
Yeah, that's what I use actually. I have these wool dryer balls and I just put some essential oil on it.
So how do you have to keep using the same essential oil, or can you reapply with a different
Actually,
oil?
what I use is peppermint.
Okay.
I just use peppermint. That sounds weird, but it deters spiders. Peppermint. So I use it for this special one bedroom where we don't. It's a guest bedroom, and sometimes spring and fall we get spiders. So I just use
Really
it for.
smart.
I use it for that.
That's very smart.
And I have used essential oils that way too, and I mix them up. And I think that you can mix them because of the heat of the dryer kind of makes the oils kind of dissipate after a while. So you can combine different ones and still not have the original thing on that dryer ball.
Okay, thank you for that.
And somebody commented. Sorry, go ahead.
Well, I was kind of going to change the subject. I was wondering if you're going to talk about carrier oils.
Yeah, I didn't do a slide on it, but I can talk about carrier oils.
Thank you.
You want to wait for just a minute and we'll get there?
Sure.
Okay, thank you so much.
Uh-huh.
I like the purification, the Young Living oils, and lavender. Love all these suggestions. So there you go. I mean, there's daily use. I think mental health is one where I think we need to use essential oils more. I think they're so good for anxiety.
You see,
and
this is on
depression.
my desk here. Actually, I just remembered I have these essential oils in my office.
So what do you have
Sweet
there?
orange, jasmine, bergamot, and this one is from Star West Aromatics, some sort of a called Serenity. But it's just something which came as a gift because I usually buy just single, single thingies.
Right. Well, that's great. That's awesome. And I think a
I
lot of
just
people
thought of
should
it.
have them at their desks like that. You
Yeah.
kind of have to store them, when you're not using them in a dark place. And I think I forget to do that. I have some that are just sitting out in daylight, and that really dilutes them.
Mine in my office are in a totally dark place. So
Oh yeah, you're in the basement. That's right.
yep.
So sleep, I would think sleep and mental health are the two things that I see on my massage table a lot. People aren't sleeping they're taking all kinds of sleep aids, and I just think, wow, you know, have you tried essential oils? You know, maybe they don't work for everyone, but diffusing or putting a little on your wrist, you know, I use a pillow spray every single night, and I can't believe how, when I don't have it, when I'm traveling or something, what a difference it makes. Bug repellent, spider repellent.
Mm-hmm. Mm-hmm.
There you go.
Mm-hmm.
I thought I'd throw this in before I get to the carrier oils. And thank you for asking about that, about the safety and storage, because I think maybe possibly people don't know about that. But they are very volatile and they're very strong chemicals. So you can have physiological reactions on the skin or internally, can occur and vary per person. So use with safety, and knowledge is power. I had one student that thought, well, oregano oil is really good for, I don't know what she was going through, something, a virus or something, but she over applied it for herself, like over ingested it, and she got really, really sick. So they're for real, and you just have to be safe and wise in their usage. You can overdose on them as well as you can on pharmaceuticals. They're sold in dark, airtight containers, usually glass bottles, never plastic. Usually, sometimes the oil can eat through the plastic. If it's a hard plastic, it may not. They can leak and contaminate the oil. Store oils in a cool, dry place, dark place, away from heat and sunlight, which can dilute the strength of the oil. And it can last up to 7 years if you store it correctly. When you do, here comes the carrier oil. If you blend it with a carrier oil, however, it reduces the shelf life to that of the carrier oil. So we've all known, like with cooking and baking, like your oils can go rancid. Like sometimes you open your vegetable or canola oil, not usually olive oil. I don't know, maybe I just use it more, but you know, sometimes those oils you don't use very often, and you open them and you're like, oh my gosh, that's really rancid. So there is a shelf life to oils, and those carrier oils, which I would list as sweet almond oil is a really good carrier oil. One I use the mostly is fractionated coconut oil. And fractionated coconut oil, basically they take the coconut oil and put it through fractionation, which actually takes the scent out of it. So if people don't like the smell of coconut, you still get the benefits of the oil, and then it never solidifies. It's always in a liquid form when it's fractionated. So I use that mostly. Jojoba oil is amazing oil. I've used it in my business. It's probably the closest to the natural skin oils. It's very expensive. What did I used to call it? I used to call it, like, I can't remember. It's golden, so I used to call it like it's worth its weight in gold or something. But what are some other ones? Whoever asked that, do you have some other carrier oils that you have used that you like? Grapeseed oil is one. That you can buy in the supermarket, actually. I don't usually use olive oil as a carrier oil.
Yeah, I don't think I've used other ones. I think sometimes I've put some vitamin E in there.
Okay.
But no, I don't know if there's some that will last longer than others.
I think it's all about just how you store them and seal them, and where you keep them a lot of times, and how often you use them. Right.
Do you use any of those for any of your results, or do you use certain ones for certain oils?
No, I haven't really gotten that detailed with it. I kind of use, you know, I determine my carrier oil basically on my clients. Because I don't usually self-apply that much, because I have it on, I'm applying and I'm absorbing it over the years myself. But yeah, I usually just use whatever is floating my boat at the time, if you would. Like I went through the jojoba time, and then I was like, okay, I think I'm going to try fractionated coconut oil. So I've been in that space for quite a while. Sweet almond was one I started with. Our industry makes a lot of different topical carrier oils, so I kind of try them off and on. Argan and sunflower oil. Huh. Okay. There's also, I mean, there's so many different oils out there. What do you like about the argan and sunflower oils? See if we can get a reply there. To me, I don't like them to be really, really thick because I do a lot of blending in my hand, quite honestly. When I'm working, I'll use a professional massage therapy cream, and then I'll squirt the carrier oil in my hands, and then I'll do 1 drop of whatever essential oil.
So she's commenting here how sunflower oil is thinner and argan is great for hair and skin. But doesn't argan have kind of a strong smell, or am I getting it confused with something else?
I personally don't think it does. I like argan oils.
There is some sort of or sort of an African oil which is good for hair, but the scent of it really bothered me. Oh yeah, maybe it was something which was already scented and I didn't like
There you
it. Mm-hmm. All right.
I'm gonna keep going. This is information I have is avoid using essential oils on infants. Cut a single dose in half for children. Obviously, it's weight related and size related, you know, like with the strength of the oil. Avoid using near eyes or other mucous membranes, and always blend them with carrier oils.
Mm-hmm.
There are, you know, in our industry, we have what's called like aroma touch, or somebody commented about Young Living oils. There's a procedure with Young Living, it's raindrop therapy. So those are used with neat oils, and they're dropped right along the spine and the central nervous system in a certain order and fashion. And so that's actually a, you know, a service you would pay for from a massage therapist that's learned those techniques and uses those specific oils. And it basically affects your nervous system, quite honestly, and it's a certain order in which it does that. So that's the one time that I can think that there's really not a blend with carrier oils used in my industry. This is just a cautionary slide of just watch the photosensitive oils, especially if you're going to a tanning bed or going to be outside in the sunlight, so you don't overly burn. It's kind of like there's pharmaceuticals, you know, certain meds that tell you to stay out of the sun. So those are the oils, the angelica, lavender, lemon, orange, tangerine, mandarin, bergamot. So a lot of times I will ask my client, like, what are you doing today? You know, just to make sure that I don't apply an oil that's going to be photosensitive for them. And pregnancy, fennel and clary sage are the oils. Should not be used during pregnancy. They contain hormone-like active constituents, which can lead to an adverse reaction to the mama. The strongest, most caustic, or able to damage tissue oils are cassia, which is very close to cinnamon, lemongrass, oregano, thyme. Always blend those oils with the carrier. I just made a listing. I kind of did a little bit of search. Rocky Mountain oils, Young Living, and doTERRA are usually from a representative that you can buy those. I actually sell doTERRA. I haven't sold Young Living, but I use a lot of their products. I am not a brand loyal person a lot of times because I like different blends from different companies, quite honestly. Now Foods and our Acacia you can buy in Sprouts. Revive is kind of coming into its own online. I have purchased those online before. They are not as strong, I would say, as the Young Living and doTERRA blends. Vitality Extracts, Plant Guru, Eden's Garden, Plant Therapy, The Vitamin Shop. So I've just shown a couple. This is Young Living oils here. This is a doTERRA blend. I actually love that blend. Or acacia, there's a eucalyptus. So I've bought, geranium oils and different, a few of them, like in the Now brand, and our acacia, before I got introduced to Young Living and doTERRA. But just want to make sure that they are using pure essential oils. Cost can vary. I mean, Young Living, doTERRA, very, very high and very expensive, I think. That's because of how they're processed, which makes them a little more expensive, it is what it is, right? It's a good thing. I just wrote a list of some of my personal favorites that I use. And I didn't really think I use essential oils that much until I started like thinking about it. I'm like, I use them every day. In my massage business, by requested or as indicated on their bodies, I made a homemade foot spray I got in this book, and I use it a lot. It's for foot odor, but it's very refreshing. So I rarely use it for foot odor. Sometimes, as massage therapists, we smell a lot of different things. So essential oils can be a blessing in those situations. But I just love this foot spray. It makes your feet feel amazing. Eucalyptus, I put it on a Kleenex, a couple drops under the face cradle, if people are not allergic to it, obviously, to keep the sinuses open while they're face down. I also have a diffuser in my room and do a blend of essential oils per the client of what they like and are not allergic to. And I have a calm blend that is kind of a big hitter right now. It's actually a Revive oil. But it's a really great smell. I think it has lavender and chamomile and vanilla in it, but it's a really relaxing blend. The Breathe blend that I showed you on the previous slide from doTERRA is one of my favorites for respiration for people like for long COVID issues. Anybody that's having has had bronchitis, I mix it with a carrier oil and put it across the chest and kind of the rib cage area in the back where the lungs can expand a little bit freer. I use an essential oil blend ointment for pain for analgesic that's made by doTERRA. It's called Deep Blue, which I really enjoy that. At home, I diffuse a lot of immunity blends, especially in the winter. I diffuse those, and then seasonal ones, that smell like pumpkin spice and all of that. In the bath, I use usually oils only with Epsom salts. I don't usually use them any other time. Sometimes I'll use like a Dr. Teal's that has like already a lavender scent or something in it. And then again, we talked about the shower with the eucalyptus leaves, like Magda does. I talked about the lavender pillow spray for sleep. I also use the Breathe blend at home, and I use the analgesic at home. And then also, I used to do this. I haven't done it frequently enough because I do have allergies, but the lemon lavender peppermint combo with a couple drops and a teaspoon of honey for allergies is highly recommended by a lot of people. That's kind of that previous slide here where it shows peppermint, lavender, and lemon. That's probably why. That's a perfect combo with blended in honey to ingest in a teaspoon.
What do you use in the lavender pillow spray?
Actually, ashamedly, it's one I bought. Like I usually buy a French lavender, and it's a true lavender. So it works for me. I don't make my own.
Okay.
Do you? Do you have a recipe?
It seems like I've made some sprays before, and I think you end up using a lot of water.
Yeah.
And
You don't
maybe
use
it's
a whole lot of oil.
Yeah. Okay.
You
Just
spray it
curious.
needed. Yeah, thank you for that.
And
Somebody
you have
else
a question there or comment.
do research on animal toxicity. Yeah, that's a really important thing because I do have a cat I just recently lost my dog, unfortunately. But I do, have you done the research on animal toxicity before? And know any oils that are not recommended for your pets? It's a great point. Oh, wow. Okay, that's horrible. I'm so sorry for your loss of your cat. Yeah, and I usually don't ever diffuse tea tree because I don't particularly love the smell of it alone anyway. I usually have a blend that I'm diffusing, but thank you for that. I will definitely research more. I'm so sorry about that. It's horrible. Ugh.
And I have a question, Judy, about which diffuser do you use? Because my acupuncturist, you enter her room and it smells beautifully of all the flowers and everything. And my if I use diffuser, my house never smells like that. You know, I have every diffuser there is in existence, and I just feel like they don't carry the fragrance very much.
Well, have you asked her where she got her diffuser and what
Well,
review?
what she said, she uses it like you know, like client after client after client. So she uses it all day long.
Yeah, I got one, basically I got one on Amazon. I bought one at Aldi before. I have one from doTERRA that I've used. So I have a bunch of different diffusers. Gifted some diffusers. So all of the ones I've had put out a lot of vapor.
So
And
are
then,
those the ones you have on the picture over there? Those are the kind of the plug-in ones which have water in them, and then you
yes.
just put there 3 drops of oil.
Yeah, I usually put more than 3. I do blends in my diffuser because I love to mix stuff. I'm a mixer. So I'll put like an On Guard or a Thieves with orange and eucalyptus and sometimes Lang Lang, add a little Lang Lang in there. So I'll use sometimes 3 or 4 different oils in my diffuser that make a certain blend and the certain way they smell.
I see.
Mm-hmm.
I see. Let me see. We have more messages here. Subliminal messages. Oh
That's
yeah. Cinnamon, peppermint, pine, all
toxic to
toxic to
cats.
cats. Yep. That's good
Okay.
to know. Good to know.
Yeah, very, very excellent input. I really appreciate that.
Thank you. Thank you.
Yes, absolutely. I did include, I was thinking, well, maybe they want my foot spray recipe. So here you go. Here's the foot spray. I got this out of Alternative Cures book and I've listed it on the next page as a bio. But you just combine a cup of, I usually do a little more than a cup of witch hazel and 20 drops of peppermint and 40 drops of geranium oil, and you shake it up in a spray bottle and you spray your feet with it. So Bill Gottlieb, who wrote the book, his recipe says to spray your feet right before you put your socks and shoes on, let them dry completely before donning your footwear, and then spray again when you get home from work, and then once again before you go to bed. So that's for foot odor specifically. And I had foot odor once in a while in my room, especially in the summer when people are wearing shoes without socks or sandals or something, but I just use it period because it just smells so great, and that witch hazel makes your feet just feel amazing.
And also witch hazel is used as a facial tonic.
Yes.
You know, you put it on a cotton ball and to clean your face.
Yeah. Witch hazel's great. So many people don't use like natural, cleaners. Like I still use the.
I just want to, most people who are here probably know it. All the cosmetics and chemicals in the United States are never tested for ingredients. You know, so we never know what is in our perfumes and all those chemicals, all the lotions and all of that, so that's why it's so.
Why are they not tested?
Because it's not required tested it's not. I will send you an article on it, or you can Google it from a reputable source, but none of the creams, lotions, none of those are tested in tested. It doesn't require testing.
Well,
Even
know,
vitamins are not tested in the United States. You just have to take it by a grain of salt. They tell you it has so you know what it has in it.
right. Well, the skin is our largest organ, and
Yep.
so I pay a lot of attention what I put on my clients and
Yeah.
on myself, because you're ingesting
Yeah.
that product
Mm.
basically, and you're
Also,
yeah.
fragrant candles. It's not the same as essential oils, you know, because fragrant candles are also toxic.
Yeah, there's a lot of, the plugins and things like that. I've heard of people add it. Has anybody ever added essential oil to their plugins on the wall? I've heard of some people doing that. Anyway, so what have you added? I don't know if what your name is, C. Martell. What have you added? Cherry? Oh, Cheryl is your name. Okay. Thank you for all your input today, Cheryl. A lot of people will add, so it's not just a fake,
Yeah, she says
yeah.
lavender. She said lavender.
Yeah. Well, thank you. I think I got one more slide that has my contact information and the bio. This is where I gained all my information from for these slides, and this my own personal usage and my years of experience, but those are the books I used. And then there's my information.
And you have to lean to the right so we can see your phone number to the other. Yeah. And shameless plug, Judy is amazing massage therapist. She did teach massage therapy in a massage school, and she gave us previously classes on types of different styles of massage, and also on stretching at in your office, how you can during your work hours you can kind of do little chair exercises. You can look it up on our intranet website. Email me if you cannot find it, or call the front desk and they will find it for you. So shameless plug, Judy is a great
Thank you,
massage
Magda.
therapist. Yep.
Thank you, Magda.
Speaking
appreciate
from experience.
Where is your practice located?
I practice, I'm in Overland Park. I actually am in the fitness center of the apartment complex where I live.
Oh,
It's about
okay.
80th and Maston. It's just west of downtown
Yeah.
Overland Park, about 5 minutes.
That's not far. Yeah.
Yeah.
I
not-
joined in late, so I didn't hear a lot of, I couldn't get my thing to work. But anyway, so I missed your beginning where you might have told about yourself. So
Yeah, I
Yes.
didn't really tell about where I work. Just kind of told about my background, but yeah, that's
Good.
where I'm currently working, and I'm still currently teaching at Wellspring School of Allied Health. I've taught there since 2001, and I also do continuing education and on top-
Accreditation. Do you still do the accreditation, or you used to do accreditation?
Yeah, I work for ABES, which is the Accrediting Bureau of Higher Education Schools, and I travel and evaluate massage programs as needed on an as needed basis. And yeah, so I kind of try to keep busy.
Well, very
Thank
good.
you for your time. Thank you for this opportunity.
Well, thank you very much for participating. Check our other upcoming classes, and I'm sure we will see Judy soon. Thank you very much, Judy.
Thank you.